Welcome to our next in the series of Tuesday Tidbits. We're going to continue our conversation about retention as a recruiting strategy by discussing the second, maybe most frequent complaint we hear from providers that are looking to explore and actively looking in the market. That is limited access to support or administration. And I'm not talking about mid-level support, nurse practitioners, PAs, the folks that help them in the clinic. What I'm talking about is limited access to leadership, not feeling like their voice is being heard. We get this complaint a lot. They feel like they don't have the ear of the administration. They feel like we're the ones that are engaging with the patients. We're the ones engaging with the community. And when we suggest changes or we have ideas, they fall on deaf ears. Or even worse, we don't even have access to the leadership with our organization. There's a lot of ways we can get around this, but one of the most creative ways, I want to share a story of an administrator I've worked with in the past who was at a fairly small facility in a fairly small rural area that was pretty well isolated. So retention and out-migration of providers was always a big issue for him. What he did was once at least, if not twice a year, he would book an appointment with his providers as a patient visit, go into the office, and then he would have that one-on-one opportunity in their office. He'd go to them to have a chance to have a conversation. Call it a checkup from the neck up, if you will. He'd had the opportunity to meet with his providers where they were at, get on their schedule, billable event, and then all of a sudden he knows more and understands more about the facilities. He had one of the lowest retention rates of any organization I've ever worked with. Keeping your providers happy, like making sure they know that they have a voice, bridging that divide between your medical staff and your leadership is a great way to keep people where they are and practicing and productive and motivated for your organization.